Welcome to this video where we'll be diving deep into Naxos disease, a rare and potentially life-threatening inherited heart condition. We'll explore its causes, how it affects the body, its symptoms, how it's diagnosed, and what can be done to manage it. Join us as we unravel the complexities of Naxos disease. Naxos disease, at its core, is a genetic disorder. It's primarily caused by mutations in the gene encoding plakoglobin, also known as JUP. Plakoglobin is a crucial protein that helps hold cells together, especially in the heart and skin. When this protein is faulty, it disrupts the normal structure and function of these tissues. The disease follows an autosomal recessive inheritance pattern, meaning that an individual must inherit two copies of the mutated gene, one from each parent, to develop the condition. Parents who each carry one copy of the mutated gene are typically asymptomatic carriers. Let's understand how Naxos disease impacts the body. The defective plakoglobin protein primarily affects the desmosomes, which are like tiny rivets that hold heart muscle cells together. In Naxos disease, these desmosomes weaken. This weakening leads to progressive replacement of heart muscle with fatty or fibrous tissue, especially in the right ventricle. This process, known as fibropathy replacement, disrupts the heart's electrical system and its ability to pump blood effectively, predisposing individuals to arrhythmias. Simultaneously, the faulty plakoglobin also disrupts cell adhesion in the skin, leading to the characteristic palmoplantar keratoderma, the thickening of skin on the palms and soles of the feet. Naxos disease is considered a rare disorder, but it's not uniformly distributed around the world. It was first identified and is most prevalent in the Greek island of Naxos, hence the name. Increased prevalence is also seen in other regions around the Mediterranean, as well as in certain populations in South America and the Middle East. The increased prevalence in these regions is often attributed to a founder effect, meaning that a relatively small number of individuals carrying the mutated gene passed it on to a larger population over generations. The signs and symptoms of Naxos disease typically manifest during childhood or adolescence. One of the earliest and most noticeable signs is palmoplantar keratoderma, a thickening and yellowing of the skin on the palms and soles. This is often followed by woolly hair. As individuals enter their teens or early 20s, they often begin to experience symptoms related to the heart. These can include palpitations, lightheadedness, fainting, and in severe cases, sudden cardiac death. Importantly, the age of onset and severity of symptoms can vary significantly among affected individuals. Diagnosing Naxos disease involves a combination of clinical evaluation, family history, and specialized testing. Doctors will carefully examine the patient for the telltale signs of palmoplantar keratoderma and woolly hair. An electrocardiogram, or ECG, is crucial to detect any abnormal heart rhythms. An echocardiogram can visualize the structure and function of the heart, revealing any enlargement of the right ventricle or abnormalities in its pumping ability. Genetic testing is the gold standard for confirming the diagnosis, identifying the specific mutations in the plakoglobin gene. Sometimes, a cardiac MRI is used to further assess the degree of fibrofatty replacement in the heart. While there are no specific classifications of Naxos disease into subtypes, the severity and specific manifestations of the disease can vary between individuals, reflecting the complexity of the genetic mutations and modifying factors. Some individuals may primarily experience cardiac symptoms, while others may have more prominent skin involvement. The clinical presentation can also be influenced by age, lifestyle, and other underlying health conditions. Unfortunately, there is no cure for Naxos disease. Treatment focuses on managing symptoms and preventing life-threatening complications. Medications such as beta blockers or antiarrhythmics may be prescribed to control heart rhythm abnormalities. An implantable cardioverter, defibrillator, or ICD, is often recommended to prevent sudden cardiac death by delivering an electrical shock if a dangerous arrhythmia occurs. In severe cases, heart transplantation may be considered as a last resort. Regular monitoring by a cardiologist is essential to track the progression of the disease and adjust treatment as needed. Management also includes protecting the skin on the palms and soles with emollients and avoiding excessive pressure or friction. As Naxos disease is a genetic condition, there are currently no preventative measures to avoid the disease itself. Genetic counseling is essential for individuals with a family history of the disease or who are known carriers of the mutated gene. Carrier testing can help couples understand their risk of having a child with Naxos disease, and reproductive options such as pre-implantation genetic diagnosis may be considered. The prognosis for individuals with Naxos disease varies widely depending on the severity of the condition, the age of diagnosis, and the effectiveness of treatment. Early diagnosis and proactive management can significantly improve the quality of life and reduce the risk of sudden cardiac death. Research is ongoing to better understand the underlying mechanisms of Naxos disease and to develop more targeted therapies. Gene therapy approaches are being explored as a potential future treatment option. Recent research has also focused on identifying biomarkers that can predict the progression of the disease and help guide treatment decisions. Continued research offers hope for improved outcomes for individuals affected by Naxos disease.